equip trainees to develop data search criteria, and then inventorying the data that they identified, and then developing a diary of contacts. So those are some of the major things that I'm aiming to achieve with this first session. So in terms of developing your criteria, this is an important part of the process of sourcing data. You need a criteria that says what data you're looking for and what data you're not interested in to help you focus your search. This on the right sort of gives us more of a full picture in terms of the steps that we recommend for doing this search. So starting here at let me try to use the pointer so you can see. Highlighter. Yeah, starting here, I hope you can see the red dot. Starting here where it says develop, update the search criteria. So you need to decide what data am I looking for which geographical region, for which time period, so that your search is more focused on the actual data that you intend to find. Once this is defined, you then search for the data on various platforms that we'll look at in a little bit more detail. And then when you do that, you keep a list of the different sources where you've searched. And then as you find the data, you tag them to say, okay, what access level is this particular data set? Is it publicly available? Can you just download it? Do you need to do some registration for you to have access to it? And then after, or is it completely sort of secured? You can't access it. You can maybe just go to the site to do analysis. So those different access levels. And then as you go, you need to keep, because it's not all the data that you can just download. Some of them require registration, requests, and so on. So you need to keep a list of contacts. We'll get back to these things. I'm just summarizing them now. And then you need to prepare a diary of contacts. So beyond the list, you need a way, you need more details in terms of who have you talked to, when, and who do you need to follow up on, and so on. And then you review the data and you say, are these the data that I need? What are the gaps? If you're seeing gaps, you then go back to again update your search criteria, and then you continue with the cycle. So that's why I said there it's iterative. You need to repeat some of these steps as needed. So we'll try to now go through each of those cycles and see what's involved in each. So defining your search criteria. Here are the 4 attributes that I'm suggesting here, but this can be expanded as needed. So you need to clearly define the geographical coverage. I think in our case, we're interested in mental health in Africa. So you might get inspiration, of course, from literature generated or data sets generated from elsewhere, but your geographical focus is the African region. So that needs to be stated within your search criteria. And then also mental health in itself is a very broad area. So the the particular aspects of mental health that we're interested in, I think it's anxiety, depression, and psychosis. So you want to say what areas within mental health are you interested in, and then are they, you want to then also specify the demographics in terms of what age groups are you interested in, the gender of the person, and so on and so forth. So this could be expanded to socio-demographic variables that you're interested in. so that again your search is more targeted towards the population that you're interested in. And then on top of that, you need to think about the time period. What time period are you interested in? Is it the last 5 years? Is it, um, you know, beyond 5 years, 10 years, 15 years, and so on, going back? So that has to be specified. So as I said, these are the 4 attributes that we are recommending, sort of as a basic starting point, but they could, could have a bigger set of attributes to use. The more you specify different attributes, the more your search is narrowed down and focused. I think as you do this searching, you see what sort of feedback you get when you're searching in the different platforms that will suggest, and then you make a decision to say, okay, do I want to be more specific, or do I want to broaden it, and so on and so forth. So as you do the search, you can get more guidance in terms of the results can guide you in terms of what you need to do. So using those attributes, you've developed your search criteria, then you actually go to do the actual searching. Utilize various data repositories and databases and platforms, and use relevant keywords for the domain and filters to narrow down your search, and consider both general and specialized repositories. So this is, you're now taking that search criteria and then using it to search in the different platforms. I think for data sets in Africa, one of the things you might want to do before you actually search for the data is to do a search of the different data repositories. What data repositories do we actually have in the continent? The preliminary checking that I did before this session, I saw a couple of repositories for publications, so research articles. But so we need to check to see what do we have in terms of data repositories. There are more established data repositories elsewhere outside our region, and there are a couple in our region. But yeah, it's worthwhile sort of first looking to see what various repositories do we have at hand. And yeah, I think a lot of our data, the data that actually exists, we either become aware of them through research articles, um, or something written on an institution's website and so on. It sort of points to one of the issues that probably has been highlighted in another module around structured metadata. It's not yet common practice for many research institutions to use structured metadata to describe their data. So at the end of the day, there's quite a bit of data out there, but it's sort of sitting on laptops or servers. It has not been documented enough for people to be able to discover it. So there's that challenge, but nonetheless, do get a list of the data repositories and other platforms that so that you can go and perform the search there. Okay. And then list the data sources and classify by access levels. So keep track of where your potential data sets are, where you find your potential data sets. Record the names, the URLs, and direct links for easy reference. So this helps you to keep track. I mean, for people who are involved in research, I'm not too sure what sort of the uh, skills level of the audience, but for people who are working in research, when you're looking for research articles, you keep track using like referencing software. The idea is that you want to keep a record of what you've looked at. That helps you not to forget about a source that's important to the work that you're doing and so on. So it's sort of the same here. You're keeping track in terms of what is it that I've looked at, what is it that I'm yet to look at, and so on. So when you keep this record, you can then go back to it at a later point as needed. So that's that. And then on the right here, you want to categorize the data sets according to accessibility. Is it something that you can just access, free? Is it just available on the internet and you can just download it once you discover it? Or is it something that requires you to register and then someone on the other end approves? Or it's totally restricted access, potentially requiring, I don't know, visit to the place where the data are deposited? Okay. So that's what you're doing in terms of listing the data sources and classifying them by access. Okay. And then prepare a diary of contacts. So you identify the relevant contacts associated with each of the data sets. So this is helping you to follow up later. These are the details that that would go into the diary of contacts. Record name, email, and other contact information, something that's relatively stable or static. So once you have someone's name, unless if that person changes jobs, that name won't change, their email, these things are more or less more stable. And then to this information here, add date of communication. Have you reached out to this person or to this institution via email or a phone call? What were you asking? What answers did you get? Just to keep track of what you're doing as you're going along. Because the more data sources you come across, there are different requirements in terms of accessing those data sets. Sometimes you contact one person and then they refer you to another and so on. So you need to keep that trail of your progress as you're working on this. Okay. And then you for each data set, you want to evaluate, select what you think is relevant for you, request for access if needed, and then you get hold of the data. So review the data sets based on relevance. Is it really touching on the things that you're interested in? What's the quality of the data? Or sometimes a data set may be claimed, a provider may say, oh, I have got this data, but are the variables that you're interested in the data, are the data complete? Are they pertaining to the population that you're interested in? So you want to check those things. Consider factors like completeness, reliability, and the documentation around the data. If the data set is downloadable, but is an Excel file that says V1, V2, V3 for the variable names, and within it there are numbers and letters that you don't understand, then it might not be very useful for you to download that data. So you want to check whether it's meeting your requirements. Okay. And then, yeah, so this actually touches on another module on this course that looks at data profiling and quality assessment. So So there is that a connection here between what we're talking about here and what's in that module, because that module goes into detail in terms of looking at the data and then seeing how good they are. So I think this bit here relates to the content of that module on data profiling and quality assessment. But this is sort of the initial checks that you're doing, and then the data quality assessment and profiling goes into more detail. Once you're happy with this, you've selected the data, you think it's relevant, the quality is good, and it meets your other requirements, then you can then access the data. If it's freely available, you can download or request for permission if needed. And you're keeping track within your record in terms of whether it's possible at all to access it. Okay. So just as a recap, you define your search criteria. You then, once you have a defined search criteria, you then search for the data. You list the different sources. You classify their access levels. You keep track of the contacts related to each of the data set as needed, and then you prepare a diary of contacts. I've just provided it as a list here, but it's really iterative. You're going sort of in a circle, repeating some of the steps as you need to. And then, of course, evaluating the data sets, and then downloading or requesting for access. Okay. So that's it in terms of the sourcing the data. I've come up with an example here of how we could do this for anxiety and depression data sets. I also have a couple of quiz questions just to make sure that we are getting along together. Here is one of them. Maybe we can take 30 seconds to 1 minute to just to look at this. What are the 4 main attributes you need to define when searching for mental health data sets in Africa? So just take a moment. I don't know, just chat, just write somewhere or on your piece of paper or on your laptop, you know, what you think the answer is, or you can put in the chat. I don't know, Diana, would it be okay?
Yeah, it's okay. They can put it on the chat.
Okay, good.
Or if they want to answer, they can raise their hands, then we'll unmute them.
Okay, that sounds good. So you, there you go. If you want to raise your hand, say something, or you want to type in the chat, that's fine. So 4 attributes, variables of interest, yes, time period, yeah, geographical location, that's good. Yes, the region / the geographical period, time period, yes. Yes, you go ahead.
This Jane, who has raised the Jane, maybe you can unmute then.
Thank you. As I've already said, they have given the answers I wanted to give, but I can say maybe I can say more about time periods. What they said is you define maybe the number of years you want. Maybe say you want to get papers that were published from say 2010 to 2020. So that is going to be one of the criteria you use. It can be an inclusion or exclusion criteria based on what exactly you want to find. Thank you.
Okay, thank you very much for that. Yes, yeah, I'm seeing also someone has added the languages of interest. Yeah. Okay, great. That sounds good. It seems we are getting along together. I will move on and go to the next bit, which is to do with an example that we have put together. So just to recap, we need the geography. In our case, it's all the African countries, the type of mental health indicators or topics that we're interested in. So anxiety and depression, prevalence rates, treatment outcomes, and so on. I'm just giving these as an example, but you are the experts working in this domain, so you can actually clarify further there, the age,
I think I've lost the facilitator. Let's give him a few minutes. Okay, there he is. Hello?
I'm back. Sorry, the
Okay,
internet
okay,
played up a little bit. Yeah, I hope it will be
okay.
better
Sorry
going
about
forward.
that.
Yeah.
Just a bit
Okay,
of clarity. If you have a question, please post it on the Q&A so that you don't miss it on the chat. So
right.
just put it on the Q&A. Thank you.
Okay. So I think I was at the point where I was just recapping on what the attributes, some of the key attributes to include. But as I said before, this can be expanded to make your search more focused. So all African countries in this instance, anxiety and depression, psychosis, I guess, age, gender, and socioeconomic status, and then also period of time. So I'm putting 10 years there as an example. So these put together, and depending on where you are searching, because different platforms have different rules in terms of how you can link these things together. So one way that I've done this is to first look at each of the topics of interest, so anxiety, depression, so on, and see what comes up. Usually, if you're looking at one attribute, you will get loads of results coming back, depending on where you're searching. And then you start to combine them. So combine geography together with the aspect of mental health that you're interested in, combine the demographics, you combine maybe two attributes, and then keep combining as you're going. I think it's essential for whatever search attempt that you're doing to include the sort of mental health area that you're interested in. Because, for example, just searching for African or data on all African countries or data on all ages or on different ages and gender, that's too generic, right? So whatever search you're putting, you want to include the aspects of mental health that you're interested in. So I've got a question. Why is it important to define these attributes when searching for mental health data sets? We could even generalize it to say, why is it important to specify attributes when you're searching for data sets online, health data sets online? You can put in the chat, or if you feel like you want to say stuff, you can raise your hand. To make efficient search, to make your search more focused, yeah. Yeah, to be more objective, to save time, relevance, yeah. To have manageable data to work with, yeah. I think it helps, yeah, in those aspects, yes. So thank you very much. I think you are saying relevant responses there. Yeah, it is important to define the attributes because that helps to focus your search. I think that's what's being expressed in different ways in the answers you're putting in the chat to narrow down your search. Yeah. No, thank you. That's great. Okay. So here we defined our search criteria. I've made those suggestions over there. And then we go and search. So utilize various databases and data repositories. Use relevant keywords, such as what I've highlighted here. So it's identifying the relevant keywords and then trying different combinations of those relevant keywords. And as we said before, consider both general and specialized repositories. By general repositories, we are talking about repositories where data from different domains are kept. Specialized ones might be, a database or a data repository on nutrition or on mental health or on non-communicable diseases. So search both. At the beginning, you'll find that your search will be very broad at the beginning, but as you get more information, you can then be narrowing it down. What I've attempted to do on the right is to provide a list of various places where you can potentially get data. I'm not saying it's guaranteed that once you go there, you will find all the data that you need, but this is a good starting point. So the Global Health Data Exchange, if you Google that, you'll get a link to it. The World Health Organization Data Repository, I visited that. There were aspects of mental health there, but yeah, I think one needs to look in a little bit more detail to see if you can find relevant stuff. The r3data.org, this is an index of repositories worldwide. So have a look and see what you can find relevant to our region. Mental Health Innovation Network, Mental Health Atlas, I haven't really visited those, but they sound like good places to go. The Global Burden of Disease Study, PubMed Central. So PubMed Central is more inclined towards research articles. But when you look into research articles, you can then, because there's always a part about what data was used in the research. So that may be a good pointer showing you what data might be available and who to contact. Google Scholar, again, and Google, just the actual Google may be a very good starting point. And then the databases, most institutions have journal article databases that they subscribe to. So those would be the places to visit as well. And then directory, yeah, as I was preparing for this, I saw this, the Director of Data Repositories in Africa. So it is an interesting place to visit, to see what might be available. And Google has this Google Dataset Search. So again, worthwhile visiting. So I just made this initial list to start with, but you need to grow it as you do your search. Then the World Bank data repository. So these are just sort of examples that I could come up with, but certainly you can expand it as you're doing your search. Okay. Again, just to say listing and classifying. So open data portals, examples of sources, open data portals of African Northern institutions. So yeah, the other thing to point out here is that a repository might not be within the African region, might be elsewhere, might be in the UK or in the US or wherever else, but it's an institutional repository for an international university that does work in our region. So you may find an Australian region that's doing mental health work in Africa. So it's still worthwhile checking repositories that are outside our region to see if they have African data there. It was a relatively common practice in the past, perhaps even now, but it's sort of changing, that a lot of data collected on African populations, you'd find them in northern institutions, because I think within our region, it's an evolving area. This proper data archiving is still an evolving area. So perhaps in the future, we'll see more of African data sets residing within archives in Africa. And then, as we said before, see whether data can be freely accessed, or they require registration, or there's completely restricted access. So it might involve talking to particular individuals who are working on the project to see if you can get access. I've got two questions here again for us to sort of look at and reflect. Just I guess keeps us going together. Just think about these questions. Some of them may not be very difficult, but they may not be complicated, but just keeps you, I guess, thinking about the topic that we are looking at. So why is it important to maintain a diary of contacts during the dataset search process? And what should you document in your diary of contacts? It's something that we covered a bit earlier, and also, the example of the content that I put there is just a starting point. You might think of other things that are important in the context of following up on a data set that you're interested in, but is not immediately available. Okay. And then, as we said, once you get the data, you want to review the data set for relevance, quality, and suitability. Consider, things like completeness, reliability, and documentation. Assess data set for anxiety and depression. For anxiety and depression, prevalence rates, treatment outcomes, or whatever else you are interested in the context of anxiety, depression, and psychosis. To the right, I've got a couple of questions. What is one factor to consider when evaluating datasets for anxiety and depression rates? Or perhaps we could rephrase it to say, what are the factors to consider when you are looking at evaluating a dataset for anxiety and depression? What should you do if a dataset requires a registration process? So you're searching, you find out that, oh, this dataset requires me to register. What should you do? Or if it says restricted access. On the flip side, you may find a dataset that has been publicly shared, so readily available, you can download it. But when you look into it, maybe you're seeing some information that's disclosive of the persons who were involved in this study. What would you do? So these are things to think about as researchers. What are your ethical responsibilities when you advertently discover something in a data set that you have been given access to, whether by downloading freely on the internet or maybe you requested and you got it. So those are some of the things to think about. Okay. This is what I have on sourcing data and inventorying those data. These slides will be available. So maybe Diana, we can have a couple of questions. The other thing that to make available is we have a document that we prepared, but it's related to COVID data. A lot of the content that's in there is relevant to searching for mental health data as well. So we'll make it available through the organizers of these sessions, so you can have a more detailed content, and then an example of you also get an example of a diary of contacts. So again, it's not cast in stone. It's something that you can use if you need a starting point. You can keep improving it. So over to you, Diana. Maybe we can take a couple of questions before we wrap up this part.
Okay. We have Edward, who has raised his hand. So probably you can unmute and talk and ask your question. Edward, are you there? Okay. I have Mr. Matagoro. You can unmute and ask your question.
Yes, thank you so much. This is Dr. Jabera Matagoro from Tanzania, and I'm glad to be part of this conversation and actually unpacking the very pressing discussion on mental health. I do work on artificial intelligence, and we have collected some few data sets. The only challenge I see, especially in Africa, is data sharing policy, because we have seen so many people doing research and projects on artificial intelligence or mental health, but the issue is on sharing the data set. For example, in Tanzania, if we are dealing with the mental health-related data sets, you may be restricted to share them in the crowd, or maybe abroad or somewhere outside the country because of the sensitivity of the data. So I just want to know to what extent the presenter have experienced that. Do you think data sharing policy would be a challenge hindering data-related or data set, mental health-related data set, or is something that we could try to unpack in a different way? Otherwise, thank you so much. The conversation is very interesting, and I'm happy to be part of this conversation because I also work on the same area. Thank you.
Thank you very much. Shall we take maybe 2-3 questions, and then we can respond?
Okay. There's somebody who's asking, could we get the data set from these sources for free?
Okay, good question.
That's the only question I have on the Q&A. So please feel free to ask your question on the Q&A. And yeah, I think that's the only question I have so far.
Okay, good. I will attempt to tackle these. If I'm not mistaken, there is a separate module that looks into data sharing agreements. So maybe it can address more of the questions from there. More of the questions that were brought up. But thank you very much for that question. I think, yes, the policies around data sharing are likely to present barriers to accessing data sets. I think mechanisms or tools or technology for sharing data is now readily available, but we are still grappling, as you rightly mentioned, with the culture of sharing. It's not yet the norm. There are still a lot of concerns around what someone will do with data once they access them. I think from our little experience, that data sharing agreements can go some way in terms of giving the producer of the data a bit of comfort. They are not a magic bullet, but they help giving the producer of the data some sense of assurance that, okay, if I'm making my data available to a researcher who has given me their details, their affiliation in terms of their institution, then they are going to use those data responsibly. So data that are made available for scientific use, not just readily available for download over the internet, but that are made available after someone signs a data access agreement. I think there's more chance accessing those than data sets that are, you rarely find data sets that are just publicly available. So there's that aspect in terms of how are people going to use the data set when they access it. And then there's also the aspect of, well, I'm not too sure whether my data as they are not disclosive of the participants who provided me those data. So there are concerns in terms of when I share, isn't the information that pertains to some of the participants that I didn't want to disclose, isn't it going to be accessible? So people tend to, or even institutions tend to hold on to the data, not wanting to share because of those reasons. I don't know how much that answers your question, but it's an ongoing challenge that we have to keep addressing. If a data producer has some data that you're interested in, but they're not readily available, you may proactively have discussions around, can I support you in developing a data sharing agreement so that I'm bound to some requirements when I access your data? But also one of the options that maybe other modules within this series of modules will cover is to do what is called federated research. And I know that the Inspire network has been looking into this, and the APHRC, they've been looking into this. I don't know how far they've gone with this, but with this federated research, instead of getting some data to you so you can analyze the data, it's you take the analysis to where the data are. So getting to analyze data from their source, maybe by sending scripts. So that's one option that I know that the APHRC and Inspire was exploring in the past. And then the other question was asking, can we get the data sets from these sources for free? It's not one size fit all. I know with the World Bank platform, for example, you can ask for access, and then you get those data sets. You don't pay anything besides requesting and then being given access. But it varies, and it's not all the sources that I listed there that I visited. So yeah.
Okay, thank you for that. There is also another question.
Okay.
Someone is asking whether they can use data from an institution, from a friend, but the institution doesn't allow the data to be used, and how can they solve that issue? I don't know
Good question. I think your friend, it's not the right thing to do. It's an illegal thing to do. You can do it because your friend has the data, but it's not something that we are recommending here to get the data illegally. So because that's tantamount to stealing, right? So you even if your friend has access professionally, if your friend has access because they're working there and they know that it's not permitted for you to use those data, I think to solve the issues, you have to request, you have to make a formal request. Most institutions, they restrict the data in terms of not just making them readily available for someone to download, but in a number of cases, when you make a request, usually, and you have a proper justification, your affiliation is known, you are a researcher, then with request, they, not always, but in some instances, you get granted the data. So the right thing to do would be to make a formal request rather than just accessing the data from your friend. Because if you do that, you know, what your friend is doing and what you both are doing is illegal. And also, how are you going to publish? When you publish, what data are you going to say you used? Because still it will come out when you publish that, oh, someone accessed our data illegally. So that's not good for you and for your friend, and it's not good for science, because science sharing data is really based on trust. We have to foster a trustworthy environment where we work. Okay.
Okay, those are the few questions I've gotten. Okay, there's one person, Yamikani, would like to ask a question.
Okay.
Yamuka, you can unmute and ask your question.
Okay, thank you very much. I'm Yamikani Sauka from the University of Malawi.
Okay.
Thank you for your presentation. I just wanted to encourage APHRC. It should not be a temporary thing when you share the slide. I think you should make an effort to organize this data set into your website. For example, you can have a resources page where we will access this data set, these links to the data sets from your page. I think you have managed to consolidate most of the experts in African mental health through this AMH Data Prize. So consolidate these efforts by organizing a page, a resources page on your website, so that it consolidates all these links to the different resources on mental health in Africa, particularly the databases and the relevant sites for accessing the data. Thank you.
Okay. There are two other, thank you very much, Yamikani. There are two other questions here. Are visual or video mental health data sets available, or they are always text-based? Some studies do collect videos, but as you can imagine, these would be more restricted access. I'm not personally aware of sort of pictures or videos that are freely available, because I guess they are a little bit more difficult to manage. But maybe others in the audience who are working with this kind of data could weigh in. But yes, I know studies that collect these, and I can imagine if those institutions are contacted, they can give you details in terms of procedures to access. I guess in most cases, and this also goes to other data sets, not just the visual and video ones. For most of the restricted data sets, I think institutions may be more willing to share if it's a collaboration. If if at the end of the day, whatever analytics or research someone is gonna do, they are also gonna be acknowledged as maybe co-authors. So there's that aspect as well, to say, okay, instead of saying, oh, may I just save this data to go and do my groundbreaking research with it, maybe making requests for restricted data to ask for collaboration and to work together on a topic of interest. Perhaps that can open doors, because at the end of the day, the data producer will see that there's also value for them in terms of making progress with public publications or evidence generation. Okay. Okay. Can clinical reports of patients be used as secondary data sets? Yes, I think they can, but it's not just a matter of going to a facility or an institution that keeps this data and then directly getting access. There is need for them to be properly prepared for research purposes, because they are collected, during everyday work of attending to patients, and the doctors are writing to help them in their work. So those data as they are not readily usable for research, but a lot of research hospitals then do preparations of those data to make them available for research. And it's usually when there was consent already from the patients or from authorities that are responsible for the project that's sourcing those data. So the answer is yes, but there has to be some considerations. Okay, I think those were the questions. So Dan, are you there?
Yes, sorry. Yes, I'm here.
Okay,
Yeah, I don't have any raised
additional.
hand.
Okay. So shall we take a break and then we start the other session in the next 10 to 15 minutes? What do you say?
Okay, in the next 10 minutes.
Okay, good. So
Okay.
we meet back after 10 minutes.
Okay.
Good. Or the user was intending for, we then say, okay, this data cannot be publicly shared. Maybe we put them under restricted access. Okay. So things to think about when you're quantifying disclosure risk. You have to think whether you're looking at population data or sample. Also need to think about what other data are already available from the same population. What are the scenarios that might lead to disclosure? You also look at individual and the global risks. So some of the methods we apply at individual level, and then the other ones look at the data set as a whole. When you're applying the anonymization, you want to apply different techniques for categorical versus continuous variables. You also want to take into consideration the hierarchical structure of the data set. After you've done your anonymization and you think the risk has reached a level that's acceptable, you want to look at the before and after the anonymization. How are the risks? How is the use of the data set before? How is the utility before and after? And are people still capable of producing useful results for the defined analysis? Because it's pointless to say, oh, here is the data set anonymized, but they can no longer do age-specific mortality rates, for example. Maybe someone is interested in children. You look at the data, you think, oh, they are very disclosive at that level. You then bunch all the people below 20 together, then they can't do under 5 mortality, for example. So those data for that purpose, they are no longer appropriate. Okay, something to keep in mind, the way we group variables when we're thinking of data anonymization. We already talked about the direct identifiers that we handle through pseudo-anonymization. And then we have indirect identifiers, which might be continuous variables or categorical variables. Someone's height, for example, might be an indirect identifier measured in centimeters. So that's a continuous variable, or someone's weight or upper arm circumference and so on. When you think of that variable, in isolation, you might think, oh, okay, it's probably not a big deal. But then when you start to think of it in combination with other things, it might become disclosive. The real concern is to make sure that these so-called sensitive variables do not end up, we don't end up finding a link between these sensitive variables and in particular individuals, such as the HIV status that I mentioned before. Okay, let's look a little bit into assessing or quantifying risk. Risk is defined based on disclosure scenarios. So these are what the research team need to think about and come up with to think in terms of, okay, do we have other data that are out there? What is the context within which we have collected this data that may render our data disclosive? So those scenarios require someone who understands the context, the place where data are being collected, the settings where data are being collected, but also domain experts who are working within that area. And we said that measures are based on, measures for assessing disclosure risk are based on a combination of indirect identifiers. The assumption is that unique combinations of identifiers have higher risk. So we look at the data and see cases where after you bring a couple of indirect identifiers together, you only find one person with that sort of combination. That's how higher risk is defined. And then we talked about individual risk, global risk, and categorical versus continuous identifiers. So these are the things that the methods use as input for assessing the risk. And that's the first thing you're doing. You are first assessing what's the risk, what is the level of risk? Is it at an acceptable level? What's acceptable? You can look at what they consider to be acceptable general guidelines that are put in the literature, but also the research team has to look at this in connection with the laws and within the country where there's data coming from. So quite a lot of context needs to come into what is an acceptable level of risk. So there's no one size fits all. You have assessed the level, you have the level of risk now, okay, this is my level of risk. Then you apply data anonymization or disclosure risk control. There are different methods depending on whether a variable is categorical or continuous. But some of the things that work with categorical variables do not exactly work with continuous variables. So what you're trying to do now is you have seen what the level of risk is when you assessed, you want to try and reduce it. So some of the methods for doing this for categorical variables is recoding. Let's say age was in 5-year age groups, and you're finding that when you combine sex, age, and occupation, you have a unique combination of someone who is 35 to 40 years old, who is a pilot and living in a certain area and is male. So you can record those ages into 10-year age bands so that that combination now has 6 other people. So you can't pinpoint to say, okay, this is so and so anymore, because 6 people are having that same combination. You can also suppress some data if they are leading to disclosure. So change them to missing. So as you can see already, we are getting some information loss. because you no longer have age groups specific to 5-year bands anymore. Maybe they're now 10 years, or maybe you've actually removed some data. There was information pertaining to age, but because you think it's now disclosing, or maybe to occupation, you remove that information for that particular, for some individuals. We will talk a little bit about, okay, how do you come up with these decisions? Sometimes variables that are key to an analysis, such as someone's gender or age, you might not want to tamper with those in the first instance, but look at other things that you may want to let go. You can also use aggregation, so bringing together some values, and then you can add some noise, so disturbs the data a little bit, using a well-defined method. It's not just adding some noise in a unsystematic way, but some way of adding some noise to your data, so that when someone thinks they've found John, they are not 100% sure. And then swapping also, you can swap around some occupations and so on. So all this thing is leading to some information loss, as you can see. And then I'm not too sure what I was aiming to do. Restricting access, yeah, might need to remove that point, unless if I think about why I added it there. Yeah, when you get these slides, it will be sorted out, either removed or a little bit more explanation added there. Or it might be that there was a variable on occupation, maybe restricting access to that particular variable to leave the other ones, perhaps. I'll look at it a little bit more and add clarification there. And then one example, I guess I've picked on this example because it's one that I used in the case study that I'll show you later, is called Winsorization. This is when you have a continuous variable, and within it, there are some outliers. So with Winsorization, you're just targeting those outliers. You get rid of them by changing them. So for example, if there is someone who is 117 years, or whose height is significantly higher or lower than others, so they're like an outlier within the data set, you Winsorize, so you don't remove them, but you change the value so that it comes together with the other values, so that this person is not isolated. So we assessed the risk in the previous slide. Here I'm showing the control of that risk by applying some anonymization, and how we do that for the different kinds of types of variables, between the continuous and the categorical ones. So it's a cycle like this. You assess risk. After assessing, you see whether the risk is still very high. If it is, then apply some disclosure control. When you apply the disclosure control, at the end of the day, assess the risk again. Is it still too high? Apply further control. So, I gave that example of changing from age bands of 5-year age. Let's say we had age in single ages. So you had age 1, 2, blah, 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 going on it. 1 year, 2 years, 3 years, blah, blah, blah. And then you find that your data is very disclosive like that. You say, okay, let's put 5-year age groups. Let's say, yeah, I'm just giving an example. And then after that, so you assessed, you saw that individual level, single age groups, single ages are not great. They're disclosing. You apply risk control by putting 5-year age groups, for example, right? And then you assess again, you go back to assessment. How is the risk now? It's still high. If you're still working, or if you think age will be the thing to work on, the variable to work on again, you control again, perhaps by putting into 10-year age groups. And then you assess again. but you're doing this together with other indirect identifiers, not just the agent. You assess again, if the risk is good now, then you assess the utility. Yeah, so there's that cycle that you're following, but you're not just doing one variable at a time. You might be working with a couple of your indirect identifiers. So continue this until risk is at an acceptable level. I put acceptable in quotes because it means different things in different contexts. So that's the cycle there. And then you assess utility at the end of the day. I have used this picture of snail mail because you know, when I was a little boy, we used to send around a lot of letters that we were writing by hand or maybe typing and then printing and then putting in an envelope and sending. But it's not very frequent now because of email and text and so on. So a lot of the mailing is happening electronically now. So because you might be wondering why I put that picture there. I think utility of snail mail has gone down. So I thought it's an interesting picture to use. But the big point here is that you want to assess utility of your data after you've applied those techniques for anonymizing the data. You want to see whether the data is still useful for the purpose that you want to share them or to use them. So compare data before and after anonymization. As we said, there's trade-off between anonymizing your data and the utility. The more anonymous the data are, that's good for the individuals who are in the data because then they won't be identifiable, but then the utility of the data goes down. So you want to strike the balance. You want to strike balance between those two. Compare the indicators. How are they looking? Are they vastly different between before and after? If data loss is too high, other options for sharing need to be considered. So if you are anonymizing with the aim of making your data publicly available, but you find that the data loss is too high, consider other options, maybe restricted access so that the utility of the data is preserved. Okay. There's a case study that I want us to look at. Let's see, I'm seeing that there are some questions. These are from, please elaborate about synthetic data. It is not clear to me. So maybe let me do that before we go to look at the case study that I have. So synthetic data is when you use some modeling to alter and to mimic an existing data set. So this is usually done by the producers of the data. You have a data set, it's too disclosive. There's that risk that, individuals may be identified, or for other purposes or for other reasons, you don't want to share the original data. You then look at the structure of the data, and then you mimic that structure. You might mimic the age distributions, the composition of the data, and various other dimensions of the data. But you make your own data. It's like fake data, but it should closely follow the structure or the nature of the actual data set. So some of the uses of this data, it then allows analysts to test out some analysis on that synthetic data without risking, identification of individuals within the original data, because you've made up some fake data out of the original data. Some of the context within, I don't know whether what I'm saying is helpful for you to understand, but some of the context within which this is used is when you want users to test out some analysis that they have in mind before they come to you to request for your data, because sometimes they request without really knowing whether the data they're asking for might have what they are interested in. So it gives them a chance to play around with the data, but it won't be the actual data. It will be the synthetic data. I hope that addresses the question. The other ones are from earlier on. Okay. Okay, I'll move on to look at the case study. This is the last bit that we are going to look at. So you should be, we should be finishing relatively soon. There's some work that we did with the cross-sectional survey data on non-communicable diseases. We wanted to make it available for other researchers to use. So we applied these techniques for statistical disclosure control to make sure that those data, the risk of disclosure was reduced. Okay. So the data came from the MEIRU, the Malawi Epidemiology and Intervention Research Unit. This is basically a research NGO that has a board comprising of Ministry of Health in Malawi, the London School for Hygiene and Tropical Medicine, Kamuzu University of Health Sciences, and University of Glasgow. And the study the non-communicable diseases survey data that we anonymized at the 30,575 adults aged 18 years and above. The data collection happened in the rural northern part of Malawi called Karonga over that period of time, and also from the capital city over that period of time. The data that was earmarked for sharing had 77 variables on the burden of diabetes, overweight, obesity, and so on and so forth. We used some software called SDC Micro. This is an R package. I have used it quite a bit, but when I checked just before this session, I saw that it had been removed from the R libraries. I think there's something that needs to be fixed. I will check with the people who developed the package, and then feedback to the organizers of these sessions in terms of what the status is. But I used it over a couple of years. Not only me, but many other research groups have used SDC Micro, including the International Household Survey Network. So this is a big survey network that brings to, among other things, brings together tools for data documentation, data anonymization, and so on. I think it's a very recent change that they've withdrawn it, but I'm positive that it will be back fairly soon, but we can provide that information at a later point. But they've put it in the R archive, so people who are power users of R may probably be able to still access it. I'm sort of an average user of R, so I wasn't too sure how to get it from the archives to use it. But that's the software we used, SDC Micro. If you Google that, you will get a lot of information about that. And in our context, we had key variables posing disclosure risk from scenarios that we identified, sitting down with the researchers and others who understood the context where the data were collected from. We saw that someone's sex, their age group, the site, whether, there are those two sites where the data came from, their education, occupation, and marital status were the categorical variables that posed a risk. The numerical variables that we also thought were posing risk were the weight, the height, the waist circumference, the hip circumference, and the middle upper arm circumference. And the information that we thought was sensitive for when someone is identified, for information that we thought was sensitive to be known when someone is identified was whether someone had asthma, BP, high cholesterol, diabetes, and so on, and TB. But it might be things to do with anxiety, depression, or psychosis, or other conditions of interest. Those may be that may be sensitive information. So those are the indirect identifiers and sensitive variables that we identified. And then this list of variables here are those variables that are things that people see. So whether someone smokes or not, whether someone is piped water, what they use for cooking, and so on and so forth. If you apply techniques to do with the suppressing some of the values and so on, you end up with a huge information loss. So there's a different way for handling them that we applied, and I'll give more details. Okay, so we said that we start by assessing the risk of disclosure. One of the methods that we used was to check for the categorical variables, the number of observations violating what is called K anonymity. So K anonymity is when you combine the indirect identifiers. So let's say, so in our case, these were our indirect identifiers: the sex, age group, site, marital status, education, and occupation. If you bring those together, if you combine them together, how many people are going to have the same combination? Yeah? How many people are going to have exactly the same combination? You ideally want many people to have the same combination, because then you can't really tell whether the person that you think you have identified is which line, because the combination is the same. So we checked how many people were violating 2 anonymity, which means how many people, when we combined those indirect identifiers, was only just one person with that combination. 3 anonymity means that that 1,700, it means 1,726 people had a combination. That unique combination was having less than 3 people with that unique combination. 5 anonymity, you say these are when you bring those indirect identifiers together, how many people, the unique combination, does it comprise of 5, less than 5 people? And same applies with the 10 anonymity. So this is what we saw, and we considered this to be very high disclosure risk. And then we also did this summary measure called the expected number of re-identifications. So this is a global measure of risk. You look at the data and say, given these categorical variables that are my indirect identifiers, what is the expected number of re-identifications? So we found that it was like 2,538. So this is some of the key results, but we did other assessments as well. And then we applied statistical disclosure control. For the continuous variables, to remove outliers, we applied what is called Winsorization. I'll show a picture that maybe tries to explain that. We did some recoding, some post-randomization method. So post-randomization method, you take that bunch of variables that I showed earlier, and then you alter them. The software, the code within SDC Micro sort of helps you to do that post-randomization. And then local suppression as well, so suppressing some of the values. So this is just to explain the removal of outliers, or that Winsorization I was talking about. So to the left, you are seeing a combination of each of the variables in the diagonal. So I think I need to use that pointer now. Okay, let's get the pointer, the laser pointer. So here, for example, we have a scatter plot of weight against height. This would be a scatter plot of MOAC versus weight. This here is a scatter plot of height versus MOAC, and so on and so forth. Yeah. So, and then this is like a vice versa. One was X, the other one was the Y, and then vice versa. So you see there are those circles that are transparent. I hope I'm using the correct term, but you see things like these are outliers. Yeah, these are outliers. We have all these outliers. Yeah. So this is before we apply winsorization. After applying winsorization, this is what you end up with. So for example, let's take this one. Height versus MOAC. You see there were a lot of outliers here, but now there are very few left. Take this one, for example, MOAC versus West. Very few now. Yeah, you can hardly see outliers, but here there were a lot of them before. So that's what winsorization does. It changes the values. One question might be, okay, what do you do with all the ones that remain as outliers after winsorization? Those you have to suppress now. But you see, the suppression that you do is much less after winsorization. So you're still keeping observations, but they no longer have the value that they had originally. They are now changed into something else to bring them together with the crowds. So that's information loss. But if you use winsorization, it's less. The loss is more limited, because now instead of getting rid of, for example, if we look at height versus MOAC, I could have gotten rid of many observations, but now I'll get rid of perhaps I'm seeing, I don't know, 3, 4, 5. So you get rid of less values. I hope that's clear. So that's how we handled the continuous variables. And then this is what we did to the categorical variables. We had 5-year age groups. We recorded them into 10-year individuals, intervals. We had 20 categories. We ended up with 7. Marital status, we grouped together divorced, separated, and widowed. Already some researchers will raise eyebrows to say, no, divorce is different from separated and so on. But you're doing this to make sure that your data is less disclosive. And then education, this is what we did. Okay, so that's recording. And then this is what I was saying about suppression of some of the values. You have to prioritize, because if you remove the sex, then the utility of the data, for most purposes will be greatly diminished. So you want to look at some variables that you think you can deal with, more suppression of those. In our case, it was occupation and education level. This doesn't mean that they are not important, but they're less important compared to age and sex, for example. So in SDC micro, you can tell it to say, my priority for suppression of values, or for removing some of the data, remove more from occupation and education and so on. When you really can't remove more from these, then maybe consider the other ones. So in our case, we found out that we got acceptable levels of risk after suppressing, marital status, education, and occupation like this. You see, even marital status, we did not suppress as much, but occupation suffered a lot of loss. You might be doing a survey that's different. So maybe occupation is really important to you. Maybe marital status is not as important to you. Then that way you can change the prioritization for deciding on suppressions. This is the post-randomization method I was talking about. What it does is it changes the variables a little bit. These are the descriptions of the variables. So these things, we thought that if we were to suppress all these, then the information loss was going to be huge. So we opted for the method of altering some of the data. It tells you how many were altered for each of the variables. So again, you are not, your data won't be the same, but at least you have some usable data that you can potentially share widely. So we said that after you apply some anonymization, you have to assess what the risk is. So when we assessed, we found that at the end of the day, this was after many iterations. I'm just showing you the final result. We found that the expected number of re-identifications was 318, which we thought was acceptable for us. And the every combination of our indirect identifiers that we identified, there were at least 10 lines with exactly the same combination. So we thought that was sufficient for us. In some cases, I've seen some instances where they want 100. So they want 100 anonymity. So it all depends on the context. Okay. So then we looked at the utility of the data. My colleague, a data scientist within the project, then looked at some analysis, performed some analysis on the anonymized data to see whether they were still getting plausible results after the anonymization. Okay. This is the data set that we ended up with. So it got deposited at a repository at the London School of Hygiene and Tropical Medicine. Okay, so that's the example that I had. And then just to, I don't know whether we want to do this before question and answer, but this example that I've shown you is cross-sectional data. What we found out as we were looking at SDC Micro, I think it's more tailored for cross-sectional data. You need to think a little bit more how to apply it if you are using, if your data are longitudinal data. So I would like to highlight some work that we did together with colleagues at at Zurich University to see what's required if it's a longitudinal data set, so that you can sufficiently anonymize if it's longitudinal data set. So this is we did this work and published in this paper. Have a look if this is something of interest to you. See what we suggest there, and then see whether it will help you if you're working with longitudinal data. Okay, that was a lot of talking from me. I think that's all I had on data pseudo-anonymization and anonymization. So Diana, maybe we can go to the questions.
Okay, thank you. I don't know whether you tackled. I have two questions on Q&A.
Okay.
Would have been so simple if you could do it in practical way. I think that's a comment.
Right.
Yeah.
Yes. Yeah. I agree. Could have been much better if we had to open the SDC Micro and shown you data being assessed and then being anonymized. But the International Household Survey Network have all the R code that does data anonymization. So links will be shared to that. And it explains step by step. There's a lot of information there in terms of how this could be done. So I do agree. A practical one could have been much maybe easier to understand. Yes.
Okay. There's Florence's Shalda, I don't know whether that's the spelling. More about Wenzization. I don't know how to pronounce that.
Yes.
And which software you use to remove those outliers.
I used STC Micro. So that whole case study that I showed was based on STC Micro. It's an R package. So I guess it's a good opportunity if you're not an R user. If you're an R user, yeah, yeah, that's also what I was saying, that it's actually not accessible at the moment, but it's a fairly stable and reliable package that has been widely used globally, not only in our case. So I'm sure it will be back on the R library of packages soon. But yeah, STC Micro, yes.
Okay. There's Priska who has raised their hands, so you can unmute and ask your question.
Okay.
Hello. I would like to ask, to request that you share the study that was done by the University of Glasgow in Malawi, if you don't mind, kindly.
I'm not too sure. Are you asking for the data or the name of the study?
I'm asking for the study itself.
Okay, just there are some publications that came out of the study that you can look at if you're interested in NCD, the results that came from the study. And this data, if you're interested in the data, you can request them from the London School of Hygiene and Tropical Medicine platform called Data Campus. So I'll share these slides with the details. The publications that came from the NCD study, I can share links with the organizers to share with the team.
Okay, thank you.
Hope that answers your question.
Yes, yes.
Okay, we have another question from Balachu. You can unmute and ask your question. Hello? Okay. While we're waiting for him, I think maybe he has a technical issue. There's somebody who is asking, kindly share the package so that you can install and learn. Somebody
Yeah,
asking.
it's STC Micro. I'll just type the name, but STC Micro. But as I said, they have at the moment removed it. I've put it in the chat. They've removed it. They removed it from R, the package of the library of R packages. But if you're an R user, it's still there in the archives, so you can access it there and play around with it. There's a lot of documentation on the International Household Survey Network, IHSN. They have a lot of guidance on how to do data anonymization in the way that I've just described. That's how I started using it, and then eventually ended up collaborating with people who developed STC Micro to do this work that I was just talking about now. But the guidance is detailed enough for someone to get started doing this. There's another question. Do you know its alternative in Python? No, I'm not aware of an alternative in Python, but a lot of people are working in this space, so it might be worthwhile. See if something of interest to you, might be worthwhile checking what might be available on the internet. So you can say statistical disclosure control using Python, and if you search that way, and then see what comes up.
Okay, thank you. There is a question from Balachu. You can ask your question. Balachu Hunde. Okay. Kyoko Dunda. Kyoko, are you there? Kyoko, your hand is raised. Okay.
It was by mistake.
Oh, okay, fine. Okay, let me see. From Q&A, someone is asking, is it possible to quickly run through analysis of the data collected?
Is it possible to run through analysis of the data collected? I don't quite get what they are asking about. That's analyzing to see what? To get like prevalences or things like that, or to do some, relating some variables to see whether there's any association between variables and so on. Is that what they're asking about? Is
I'm
it
not
possible
sure.
to
Let
quickly
me.
run through? Yeah. I'm not too sure what the question is aiming at, because our focus in this session is not looking at, okay, what were the results? What are the findings from this data? We are looking at how do we preserve, privacy of individuals in the data.
Okay. Okay, fine. Edwin, I think I've unmuted you, so if at all maybe you want to ask a follow-up question, please, you can raise your hands. Then you say, okay.
Yeah, he said interpretation and association between variables.
Okay.
So this data can be requested for, and then you can analyze. So this SDC micro is an R package. So we know already that R has, capabilities for analyzing the data. So if it's useful in your context to perform some analysis on the data while you are looking at while you're trying to anonymize the data, then you could do that in R, I think. Yeah. Okay.
Okay.
What is the importance? There's a question from Idosa. I hope I'm saying their name correctly. What is the importance of data winsorization than directly removing the outliers? So winsorization is not removing the outliers. It's changing extreme values to bring them together with the other values. So at the end of the day, let's say someone is 2.5 meters tall in a population where the next tallest person is maybe 1.87 meters. So this 1.87 meters person is probably closer to the rest of the other heights. But this 2.5 meters person is an outlier. So that makes them very easy to identify. So winsorization would use some statistical methods to change their height so that it's closer to the other values. So you're not removing that outlier, you are changing its value. So you're altering the data. You're not removing that value. You're changing it. Yes, it is information loss, because at the end of the day, the height that we're going to have for that person is not what we started with, but kind of keeps the data available. So that's part of the loss that you make while you are anonymizing data. So it is winsorization, I guess, is important in that it preserves more of the data. Directly removing, then you are losing more data. With the winsorization, you're losing in the sense of changing the value, but at least that person will have a value. I hope that answers your question. What entry-level role may you have for the newbies in research and trials, please? I don't know whether this question is in the context of statistical disclosure control, or it's just a broad question. I'm not too sure. Maybe Charles can clarify.
Okay, while we wait for him to clarify, Belachu, are you able to ask your question now? You can unmute. I've seen. Okay, there you go. We can't hear you. Okay, maybe you can type your question on the Q&A. I have Priska. I don't know that it is an old hand.
I already asked my question, sorry.
Okay, let me know. From the Q&A, okay, I think we're done.
Yeah, I think so too.
Mm.
Okay.
There's
So
uh-huh.
so over to you then, Dan, unless if there's another question.
Oh, there's one person who's asking, what entry level role may you have for the newbies in research and trial, please, in statistics?
So yeah, I'm not too sure how to link this to disclosure control. Yeah.
It's fine.
Yeah.
Okay, fine. Thank you so much, Shifundo. We've had quite engaging training. I know so many people have learned a lot from this session. Thank you so much for being engaging also, the audience. We really appreciate the fact that you joined. Okay. Okay, I saw some people raising up their hand.
Right.
Okay, fine. Thank you so
There's-
much.
Yeah. Yeah, I know, just people pointing out that, okay, this needed to be more practical. Yeah, I take that. I mean, we can improve on it in the future. Thank you for that feedback. Yeah.
Okay, fine. Before I invite the panelists to give out their final remarks, do you have your final remarks, Dr. Shifundo?
No, just to say thank you for coming. It was a pleasure talking through this. We'll make the slides available, make the reference materials available, and